If you've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan. Nobody is talking about taking that away from you.
President Obama made that promise to Americans, but in one state, that may no longer be the case with respect to insurance. Aetna announcing it plans to stop selling individual health policies in California. Will other insurers follow suit? Joining us now, Stu Varney, host of Varney and Company on FBN. So what does this mean in the individual health care market? So it's not to big employers.
No. If you go out and buy your own health insurance, you're an individual, you're a family, you're not getting it from your employer, you're not on Medicaid, you go out, you buy it yourself.
So they're out. Aetna's saying to those people, we're done in California.
Now, this means 49,000 people or families in the state of California will soon be getting a letter saying, you're no longer covered by Aetna. You've got to go out, find your own coverage, which means you will probably not be able to keep the doctor, you'll not be able to keep the policy that you like, and essentially your price is going to go up.
Why are they leaving?
Aetna's not saying, but the theory is, look, here comes Obamacare, and they haven't written the rules yet. So Aetna doesn't know what kind of policies it has to put out there on the individual market. There is mass confusion.
So there's no certainty.
There is no certainty. In an uncertain environment, companies like Aetna, they don't want anything to do with this relatively small part of their business in California. They simply walk away from it. And other insurers in other states may well do the same thing.
And what does that lead to?
That leads to a whole bunch of people who will not keep their policy, keep their doctor, and keep the coverage which they like, in contrast to what the president said back in 2009. This is millions of people, by the way. Millions of people will not be able to keep their coverage, their prices, their doctor, and the policy that they like.
So, but what happens to them then? Do they move on to another insurer, or is the market for other insurers shrinking as well, so they wind up going to Uncle Sam and these subsidized plans that we're paying for?
Precisely. They will probably move on to these subsidized exchanges. However, there's no certainty of that because we don't know exactly what kind of policy these exchanges will have to offer. Or they will pay a fine and just not have coverage.
Where is the accountability on this, Joe? Because, you know, we see the president on camera, and he made that promise repeatedly, by the way.
He did.
And yet, every day we have a new piece of information talking about how actually you're not going to be able to keep that insurer, and you're probably not going to be able to keep that doctor because he's bailing from taking insurance altogether, and so on. I mean,
the president has been conspicuously absent on making any comment about what Senator Marcus says is an impending train wreck. And just let me tell you what Senator Rubio said in a video address to his constituents this weekend. He said Obamacare is bad for America, can never and will never work, will contribute to bankrupting our country. So the opposition in full cry on Obamacare, nothing from the president himself.
Thank you for that happy note to end the segment.
Have a nice welcome to the early mornings.
Thank you, Stu. See you at 9:20 today.
Yes, you will. Thank you.